Velkommen til Under huden med Asteta Clinic, podcasten der vi snakker om estetikk, plastikkirurgi og kosmetiske behandlinger, men også menneskene, tankene og historiene bak. Mitt navn er Kenneth Chiu, jeg er plastikkirurg og lege, og i dag så er jeg så heldig å ha med meg en gjest, en amerikansk plastikkirurg, som heter Macias. Og derfor så vil resten av denne episoden gå på engelsk. For de av dere som ønsker dette tekstet, så kan dere se dette på YouTube. A big welcome to you, Dr. Macias. It's a big honor to have you here in Oslo with us. You're a plastic surgeon back in LA, coming all the way to us here in Oslo and having lectures. We just came out of the Congress now, and just now you showed me some really impressive results for your facelifts. So I think we're going to touch a little bit about that. But before we go, I just want to ask you, have you been doing something here in Oslo? Like looking around or?
Well, we just got in last night. We went to eat at a nice little gastropub. It was actually quite good. And the Congress today, there's been a little rain. I guess we brought the LA rain with us.
Yeah.
It doesn't actually rain that much in LA. We didn't, but I heard you guys had a nice day yesterday, but we missed it.
Yeah, unfortunately. Have you been looking at the Norwegian population or people walking around the streets of Oslo, or do you see any similarities or differences from the LA people? I mean,
it's not my first time here, right? I think this is the third time I come to the NAM conference. There's some differences. Obviously, I think that a little more natural appearance is something that Norwegian people like quite a bit. But I think in LA, there's a section of people that are very similar. I think everyone has this idea that everyone in LA wants to look super done. And there are those people that want to look that way, but there's plastic surgeons for everyone, right? There's some that do the super done look, and then there's some like myself who specialize in more natural looking results. I always like to say that, I don't want my patients to know that their friends to know that they have a plastic surgeon, and that when they say, oh, why do you look so good? And they're like, well, it's, and they tell them the secret. They're like, oh my gosh, I never would have known. And that's how I get my patients, right? It's from those patients who don't tell anyone. And then when they happen to tell someone, they're like, oh, wow, that was so undetectable. I didn't even realize you had something done. And that's, that's what I do. I do more natural looking things.
Yeah, I think it's really something that you're touching now, because a lot of people, they think exactly like you're saying, that the American patients might want the overdone look, etc. But like when I came to visit you in your clinic in 2019, which of course was a great experience for me to see how you treat your patients, and I also saw that of course the technical aspects of what you do, but also how much you care for your patients and really was there for them, the whole thing. But I think what you're saying, and what I also like about knowing you, is that you feel the same about the natural appearance and the natural results, which is something that I think Norwegians in general might not believe it's like in LA or Beverly Hills, which is where you work.
Everywhere there's places like, the Miami market, LA, there's some people that want really exaggerated looks. They want to know, they want people to know they had plastic surgery. But like New York City tends to be a little bit more subtle, and certain parts of LA as well. So there's something for everyone. So that's the beauty of it.
You think this is also something that is about to change with is it more trendy now with the more natural looking, or?
No, I think it's trending a little bit more now. I think that when I first started saying that, we specialized in natural results at Aesthetic MDR, my practice in Marina del Rey in Los Angeles, people would be like, what does that mean? And what I meant by that was we were trying to make things that look like God could have possibly made that result, not a plastic surgeon, right? Like they could have been born that way. And that was what I wanted to provide for my patients. And, now no one asks, what does that mean? Everyone knows that everyone's looking for natural results. All my friends are talking about natural results. And that's been in the last 5 years, really, because I started Aesthetic MDR 6 years ago. I was in another practice for almost 6 years before I established my own practice. And that was kind of like my twist on it 6 years ago, and now it's pretty commonplace.
But now that you are here in Oslo and giving speeches about different topics, I think it's also really interesting for the Norwegian audience to hear a little bit more about that, because like you mentioned, now this week is what we call the NAM, which stands for Norwegian American Aesthetic Meeting. So it's a collaboration between the Norwegian Society and the American Society for Aesthetic Plastic Surgery. Mm-hmm. And I know also you give speeches a lot around the world on different conferences, but the and also you have these fellows in LA also mm-hmm. learning a lot more about aesthetic surgery. So I think you're a good educator, and it's nice to kind of share the knowledge. How do you look at it, like going around the world giving speeches and teaching the younger guys coming after us?
So in Los Angeles, it's kind of nice that we have a group of people, surgeons who like to share ideas, people like Ritu Chopra, Ben Talay, Mark Mani, people who are really focused in on facelifts, and we can, I visited their surgery centers and been able to watch them operate and talk about facelifts and geek out on them, just talk about techniques, what works, what doesn't. So that's fantastic. And also having the residents and the fellows there with me. I teach the residents at the University of Southern California, USC. So having a chief resident there, a fourth-year resident, and the fellows that come from all over the country. And a plug for our fellowship. Our fellowship is the Aesthetic Surgery Fellowship of Los Angeles with Jay Calvert and Ash Gavami, Ritu Chopra, and Justin Perez. And it's, arguably one of the best aesthetic fellowships in the United States. And it's the Aesthetic Society endorsed fellowship. So we get these top applicants from all over the world, mostly the U.S. There's been a couple Canadians, but from the U.S. and they're fantastic, and they push me. They ask questions. So having just this group of people, very experienced facial plastic surgeons, and then residents and fellows is a nice sort of breeding ground for us to continue to develop facelifting. So it's really nice to have that kind of community in Los Angeles.
And I think it's really nice that you are able to share your experience, your expertise, and kind of put the patient quality, the services that you can deliver and everything first. And because, I guess you are also kind of competitors for the private aesthetic patients.
100%. Like Dr. Chopra, Dr. Mark Mani, Dr. Ben Talay. Even Chachikeo is going out and talking about his, he talked a lot about his endoscopic stuff, and we're all, around each other, but we're all in it trying to improve our own results and get better and move forward. And, it's even multi-specialty, right? Because Bentelle's a ENT, so he's a facial plastic surgeon, and we're plastic surgeons, and we're collaborating and learning, all kinds of things from each other, which is amazing. It doesn't have to stop with a specific specialty per se. But obviously, some are more trained than others, because there are some in our communities in the United States who aren't facial plastic surgeons or plastic surgeons, and they're doing that kind of surgery. There's like cardiologists or general surgeons who are calling themselves cosmetic surgeons in the United States who are also performing this kind of surgery.
Yeah, we have that same problem in Norway, actually. We do see like general practitioners doing liposuction, other kind of cosmetic procedures, as well as orthopedics, or at least, other kind of doctors or specialties that aren't like specifically trained for plastic surgery and aesthetic surgery.
Yeah.
Which is kind of a way it's like a bit sad in a way, because I think it kind of, at least they can get some negative attention and kind of pull all the others that are more serious with them.
Yeah, there's been like headlines of, this famous plastic surgeon. You go and look them up on the website. In the US, we have one called abms.org, is my doctor certified, my physician certified, and you look them up and they're an OB-GYN. or they're a dermatologist, and they're touted by TMZ as a famous plastic surgeon, and they're not plastic surgeons, right? So even the public they're deceived by people calling themselves cosmetic surgeons. I'll have patients that come in and like, oh, and I look up who their surgeon was before, and they're like, oh, I went to this plastic surgeon. I'm like, that plastic surgeon's name doesn't sound like I know most of the plastic surgeons in town. Look them up, and of course they're not. They're a cosmetic surgeon. They're not a plastic surgeon. They're not board certified by anyone.
But I think it is important that patients do some research.
They should
check what kind of qualifications they have, among other things. They should evaluate, of course.
Is there a way that in Norway people can check to see if someone's board certified?
There is a website where you can find the list of who are kind of certified as a plastic surgeon.
Yeah, that's a good start because I always tell people, look your doctor up, make sure they're at least board certified. Because, that's a bare minimum in my book, Make sure that they got their certification. Because, if they went through the training and didn't get certified, or if they didn't even get the training and they're out there practicing,
definitely.
Yeah, I think it's of utmost importance.
But except for that, how is the competition for patients in US? And regulations? Are you with the marketing, etc., or are you only based with referrals from other happy patients?
Well, in the US, there isn't too many restraints, I guess, on marketing. I think there was a time when it was frowned upon for you to be on the internet. There was even a time where it was frowned upon for you to dance on social medias. But I guess you just can't dance while the patient's asleep in front of the patient, but you can dance all you want in your office and no one's going to say anything, right? As long as the patient's not under general anesthesia. You can dance in front of your patient as long as they're willing to let you dance in front of them, right? Mm-hmm. So I think that it's changed a lot. We can show before and afters. I know there's other countries like Brazil, you can't show before and afters.
We cannot in Norway.
You cannot in Norway.
We can in office, but not online or out there.
Well, if you publish an article with before and afters, then you can show your article.
Yeah.
Yeah, I think that's a way that many people get their before and afters out in countries that aren't able to publish their before and afters on social media or on their website. You can't even have them on your website, huh? Mm. Yeah. Yeah, that's very helpful to have before and afters available for patients to see.
But don't you see a lot of cheating with it as well?
There is some. Yeah. There is some photo, like photoshopping, and that's just straight up cheating. But there's a lot of trickery with just lighting.
Lighting, angles.
Just lighting and angles is enough to deceive people.
If you just turn your head a little bit.
The head forward, back, just enough to get rid of some skin. So
I think we can spot it quite easily, but for patients in general, it's hard to tell, or it's very easy to be really impressed by the photos.
Yes, and that's true.
So I think, I've thought about it a lot, because since we're not allowed to publish the before and afters, it's kind of a little bit restrictive. But at the same time, since I'm here, I'm also kind of liking it, because you don't see that, the other side of it.
I can see that, because when they were talking about banning TikTok in the United States, I was like, oh, that'd be kind of nice, Then you don't have to worry about another platform to do more things on, and if your referral base was enough, which, lucky for me it is. That's why I don't do that much on TikTok or social media that much. I have a presence because it's kind of like your business card nowadays, but it's not my primary source of patients. Most of them come from referrals, word of mouth.
Yeah. But I think it's really interesting to hear how things are working for you guys in LA. But in Norway we do see, and we don't have numbers, but we do know that a lot of Norwegian patients, they travel abroad for cosmetic, what we call cosmetic tourism. I'm sure that you have this as well. I know a lot of people go to different places to do different kind of procedures. And how is you as a plastic surgeon and the society over there handling it?
Well, we're so close to a border, right? Mexico's 2-hour drive from Los Angeles. So many patients do go to Mexico for surgery, and in Mexico, the surgery is a little more affordable. And you can get great results in Mexico if you know who to go to. The biggest problem is if you talk to a surgeon, they say they have no complications. They're one of two things. They're either a liar or they're not operating, right? So complications happen. And when you have that complication, you want to be near a surgeon. So I've had patients that I take care of that say, hey, I went to Tijuana, I had surgery done there, and I have this complication, but it's been so hard to go back and forth. I need some follow-up. I need someone to take care of me. That's the hard part, that follow-up, the little just looking at the scar and all the things that you have to do post-operatively. People think you're just buying like a product from a shelf, and that's not what you're buying. You're buying a relationship with your surgeon.
Absolutely.
And you need that relationship for the pre-op, the post-op to get you through it. It's an emotional thing. It's not just the product, the surgery, the day of surgery. Yeah. Us surgeons like to think that's what we're providing mostly because our technical skill. But it's all the other stuff that really
it's a package.
Yeah.
And you also have to see the whole human, and
you need all that stuff. And so that's what suffers with the tourism. Yeah, you get a better price, but you don't get all the other stuff that's very, very important. And you might get away with it for a surgery or two, or your friend got away with it. And so you think you might be able to get away with it. And if something happens while you're under anesthesia, what then happens? Do you go to the local hospital, and what's the care like at that hospital? What hospital are you going to? And all the things that you kind of have to think about that most of the time don't happen. But if they did, what would happen?
But does the government have an eye on this, or are they just letting it happen?
I mean, there's no way you can stop someone from going to a country and have surgery, So the society talks about it. We try to educate people, but we can't stop people from doing it. Yeah. Here, you're so close to other countries. I think Turkey's got a big medical tourism. They're even going because of TikTok and Instagram. They're even going from the U.S. all the way to Turkey when they could just go to Mexico and get great care there too. But Turkey's famous right now for that. And I think Guadalajara had a facelift result that they were showing. Someone from Guadalajara that had a really nice result for fraction of the cost. So that person's quite busy.
I think there are some problems with it. Of course, like you say, it's when you are in trouble or have something that you need some extra care. It's really difficult because you have to travel, and it's just inconvenient and kind of impossible to just go back and forth to Turkey every time you need someone to look after you. But of course, it's also at least the Norwegian patients, they go there because they want the lower price. And definitely you can find really good and skilled surgeons providing excellent results and good care in Istanbul. I've been there to a congress myself and seen a lot of good surgeons over there, but I don't think necessarily they are the ones that offers the lowest price. And still, even if you do it, it's still far and a long way to travel.
Yeah, I've gone to visit surgeons there to see their techniques. Yeah. There's fantastic surgeons there. And on average, they're going to be a little cheaper just because the cost at the hospital, labor costs, and all those kind of things are usually a little less. But yeah, you run some risks like we were talking about. That's all. Yeah.
I think it's also a little bit, since I have you here in the studio, it would be really fun to hear if you see some kind of trending in the hub of plastic surgery in Los Angeles. Do you see something special going on? Like BBL, when it came, we heard about it from the US first, and then it started to move over to Europe and Norway as well. And now we have heard about the yoga boob and other kind of things. But do you see something that maybe I haven't heard of, or something that...
Let's see, the yoga boobs, the small implants, like the Preservé implants, the Privé.
The ballet boob.
The ballet boob. Yeah. Let's see. So BBLs are getting smaller. We know that. Facelifts are getting younger. I don't know if you're seeing that trend here, but we're seeing facelifts in younger populations now. People are tolerating jowls less. They're tolerating skin laxity a lot less. And we do know that the earlier we do it, the longer it's going to last and the less likely that it's going to be noticeable. So there's some famous actors that you guys have seen that haven't really aged. That's because they've progressively got their facelifts done and redone and done again since their late 40s, and they really haven't aged much. That kind of, I think, earlier facelift trend is for sure a thing that is very popular right now. And I'd say it's what I see trending.
Yeah.
And obviously some other things like regenerative stuff, like stem cells and stem cell related.
I feel a lot of people, they want to know about trends and think that trends are important. I think it's a little bit opposite for me as a plastic surgeon. I do think that trends not necessarily is that good in a way. I think I'm looking for more kind of established treatments, good alternatives that gives and provides the best results for my patients, not without like just jumping on the next train and trying something new. And I don't know, how do you manage in the world of everything moving forward?
I'm very similar. I don't jump right away. Like for instance, Renuva, which is fat, hydrolyzed fat that is used for injecting to, instead of using your own fat, you can take an off-the-shelf product and inject that. It took a while to start using that, made sure that data was there, that my friends used it, and that there were no issues there. Same thing with Renuvion, which is used to be called J-Plasma, helium-assisted radiofrequency device. It took a while to bring that on board, and I talked to my friends, the trusted friends, that I made sure that I knew that, you know, how to use it, not to burn patients, and that it was safe and effective. So I don't like to be late to things, but I also don't want to be the first to try it and make my patients sort of guinea pigs. So I think it's that balance of getting in early enough so that you are offering your patients great things that are new and innovative, but not too early to where you don't know what the results are. Because, I mean, there's a lot of things that, like, for instance, for cellulite that I've tried. And I think that's probably cellulite that led me to this, like, okay, a little more conservative. Like, early in my career, I was trying all these cellulite things to try to treat them, and I realized that most of them don't work. And I've gone from one thing to another to another to another, and none of them have really worked that well. So that I think that's what's led to my more conservative approach on bringing on things.
Well, I think that's a good roundup for a nice episode. Thank you so much for coming to Oslo and sharing your knowledge with all of us here. And thank you for being in studio, also sharing a little bit more on the inside of our lives as plastic surgeons. Tusen takk for at dere lyttet til Under huden med Asteta Clinic. Vi som alltid glade for spørsmål og engasjement. Send oss gjerne på vår Instagram, eller på e-post til post@asteta.no, så høres vi i neste episode.
Well, thank you for having me. Thanks for being such a great host. And I can't wait to come to Oslo again.
See you next time.